Hey guys, it's Dr. Justin Southall and Chase Moy with Eastern Shore Chiropractic and Sports Clinic in Fairhope, Alabama. Today we're going to talk about temporomandibular joint dysfunction, or better known as TMJ. So, if you've been to the dentist already, had your jaw checked, had that bite checked, and you're still having pain, then give us a call. Come see us, 251-990-8383. We'll check it out. We'll do a detailed evaluation. I'm going to show you a treatment in just a few minutes. That's the reason why I got my gloves on. And then right now I'm going to show you some exercises and some mobility work to do at home to loosen up the jaw on your own before you come see us. So Chase has got a Supernova ball from Rogue Fitness. It's our go-to ball. It's amazing. So it works for everything. So what he's going to do is he's going to take the ball, he's going to work right into the masseter muscle, which is right through the jaw right here. And he's just going to move it and just work it right into that area. He's going to open and close his jaw as well, or his mouth, and he's going to work that. This should not be terribly painful. It should be a hurt so good. If it's extremely painful, or if your jaw is shifting or moving when you're doing, stop, go see your dentist, okay? He can also work a little bit up into the suboccipitals, just like he's doing right there. And he's working and he's turning his head and working that range of motion, because if the occipital muscles get locked up, it's going to create tension through here, which is going to lock the jaw up. He's then going to move into his SCM, which is his sternocleidomastoid muscle, and he's going to release it because it's pulling down through here. And anybody with a desk job, or if they're sitting, or if they're clenching, these muscles are tightening up. So he's going to work all through that area through there. So from here, if you're still having some pain, you want to target it a little bit more, you can take your the pillow you have at your house, on your couch, wherever, and you're going to lay on your side and you're going to put the ball right in the middle of the pillow, and he's going to target those muscles again. This allows him to provide a little bit more direct pressure to that, and at the same time he's getting a release to it. So he's holding a little tension on there, applying pressure into the masseter, the temporalis muscle, and getting a good release. It's going to increase that jaw range of motion, and it's going to decrease that tension, tightness, and pain that you're having. So from here, he's going to go ahead and go to his back. He's going to show you one last position. He's going to take the ball and he's going to target it right in his occiput. He's actually going to lift his head up, and he's going to sit it right on it, and he's going to allow his head to extend backwards a little bit. It's going to be a traction. It's almost like someone's hand is under there, just lifting up the back of your head, base of your head. Again, this should not be painful. You're not putting it directly on the spine. You're putting it just at the base of the head, connects to these muscles right here. And he's just going to release that and lean back, and he's going to turn his head to the left and right. This will be a little bit more tender, especially if these muscles haven't been worked, and if they're super tight, causing some of the tightness through here, grinding effect of your jaw. This is going to help. So from here, he can do some of his self-treatment that I'm about to show you, but he's going to do it to himself with his thumbs. So go ahead and sit up just for a second. So he's going to take his thumbs and he's going to put it right on your masseter, and he's going to run it straight down through. Just go right down through, and he's going to open his jaw up as he's doing it. And this is going to be a little painful. We apply pressure and just slide down. Again, there should be no deviation with the jaw. There should be no pain. You should not have any clicking with this. If you do, again, go see your dentist. Go ahead and lay on your back. The other thing he's going to do, one reason I've got my gloves on, is you got the medial and lateral pterygoid muscles, which is deep into the mouth. So I'm going to go ahead and have him open his mouth, and I'm going to show you all how to find it. It's going to be right past the last molar. So I'm going to go straight in, all the way past his last molar, and I'm just going to have him bite down slightly, and I'm going to find it lock up, and it's like guitar strings. So open up, and all you're going to do as you're self-treating is you're going to slide that finger down right through those guitar strings and release it as you open and close your mouth. That's going to help those muscles that are deep in here release. So how do we treat it here at Eastern Shore Chiropractic? I'm going to show you if I can get my glove off here. There we go. So first thing I'm going to start out, we're going to do a little bit of dry needling and acupuncture on this. So I'm just going to clean this area, get a sterile environment, and I'm going to take my dry needle, my acupuncture needle, and I'm going to have him clench down, and I'm going to find that area where there's a lot of tension, or you may have a really tight, tender spot there, super painful. What we're going to do is we're going to target that area. So I'm going to bring that needle in, he's going to clench down for me, and then he's going to relax that jaw, and I'm going to tap it in. I'm going to take that needle, and then I'm going to go in, and I'm just back and forth. Open a little bit, relax it, there you go. Any pain with that? So in and out till I get a good release. Sometimes we'll see that masseter muscle just release just as he's sitting there. So we'll leave that in just for a second. We'll take it back out. We'll be done with treatment. We'll put it in a sharps container. And that's one of the treatments that we'll do for TMJ after our evaluation. So we're then going to come to here. I'm going to have him open and close, and I'm going to see if there's any deviation. If there is, I'm going to use something called active release technique, or I'm going to use some fascial distortion depending on his presentation. So if he's telling me he's got a certain presentation, I'm going to use fascial distortion. If it's tight and locked up, I may use both, or I may use active release. So I'm going to have him open his mouth, and I'm going to run a band right through here. He just had a little click and release as we just did that. And we're going to open that up. So from this angle, so you can see it better, I would run right down through here, or I would hold tension on that masseter and go ahead and open and relax. And that's just going to release the masseter. I can get up into the temporalis as well. We'll also target suboccipital muscles, the trapezius. Finally, two other things that we'll do with the treatment will be wide cold laser. This is the MR4 cold laser. It's multi-radiance medical. It's phenomenal. It lights up and has a sensor on it and tells me when I hit an area of dysfunction when the screen light changes. We'll treat him with a laser, having him open and close his mouth, going through different ranges of motion. And then lastly, we use a rapid release device. The rapid release is amazing. It's the highest speed percussor on the market. It releases these muscles of mastication super fast. It's amazing. So go ahead and sit up, man. So if you're having TMJ pain and you haven't been treated for it, or you've already been to the dentist, you're wearing a night splint, but you're still having that pain, give us a call. We're Eastern Shore Chiropractic and Sports Clinic. We're in Fairhope, Alabama, 251-990-8383. You can visit us on the web at easternshorechiropractics.com. Again, it's Dr. Justin South on Chase Moy, and we are your Fairhope chiropractor. We are Eastern Shore Chiropractic, and it's your life. Live it in health.